Dr. Pham with Reach Pediatric Rehab here today, and I wanted to talk a little bit about GMFCS levels. Now, we've talked before about the classification of children who have CP in terms of topography, in terms of muscle tone and movement disorder, and another way that we categorize CP is by functional level. And when I say that, it really implies gross motor function, so a child's ability to get around in their environment. And we do that using something called the Gross Motor Function Classification System, or the GMFCS. And this is a scale that's used in children who have CP, and it describes their ability to get around their environment. Now, I have a picture here. This is on the website for the CP Alliance in Australia. And so you'll find pictures of the GMFCS level online, and you'll see the pictures that generally come up are of a 6 to 12-year-old child. So if your child is younger, obviously this may look different. If your child is older, this may look different. So this is a 6 to 12-year-old. A child who functions at a level 1, this is a child who is ambulatory without an assistive device. They can go up and down the stairs without using a railing, but may have some difficulties with higher level balance. For a child who functions at a level 2, this is a child who maybe needs some help on uneven surfaces or holds onto a railing when they're going up and down the stairs. For a child who functions at a GMFCS level 3, this is a child who probably needs some sort of device to help them walk, whether it's a walker or crutches. They need that in order to be able to get around and walk around their environment. Many kids also this age, for long distances, will use a manual wheelchair, a wheelchair that they can propel. And that's oftentimes as children grow, their environment grows, they want to keep up with their friends, and they're able to do that with a manual wheelchair. For a child who functions at a GMFCS level 4, this is a child who is able to ambulate some with a more supportive device such as a gait trainer, and with assistance from a care provider for things like steering, going through doorways, things that are a little more complex. But they are independent with power mobility, so a power wheelchair. And for a child who functions at a GMFCS level 5, this is a child who is dependent for all of their mobility. And so they have someone who pushes them in a manual wheelchair. And this manual wheelchair looks very different from the manual wheelchair that the child who functions at a level 3 is able to self-propel. So those are the GMFCS levels. They were described by Robert Palisano in a paper that was published in 1997 in Developmental Medicine Child Neurology. So if you see this anywhere online, which you'll find it all over the place, this is how we describe gross motor function in a child who has CP.